Warning, this content is for entertainment and educational purposes only. What's up, everybody?
Good morning.
Morning.
So I put 41 days until the we got Dr. Marv with us today. Dr. Marv's going to join us.
Okay.
Dr. Marv.
Good morning. Good morning.
Anybody's got rehab or therapy questions, or you fucked yourself up in the gym, Dr. Marv is your man. He's helped me out with my shoulder injury.
Good.
I put a video up this week going through the Serostim prescribing information in the phase 3 clinical trials.
Mm-hmm.
And when I was going back through and editing it, I realized I said deciliter, not deciliter. And I'm like, am I going to go back through and re-record this just because I misspoke one word? Nobody's going to catch this. God fucking damn it, man. Everybody in the comments section was like, people... You fucked up at 1936 and 0.0 seconds. You said that is incorrect. I'm like, God damn it, man.
They will catch it. You just have to get ahead of it. So you just post right away. Like, I said the wrong word here. My fault. I just had a brain fart.
That won't fix it.
Just get ahead of it.
Oh no, I put it in the comments. I the ones I love is when people go back through and in your video in 2019. August 22nd, you said this, and now you're saying that. I'm like, yeah, I changed my fucking mind, man. That happens.
It happens a lot.
Opinions should be hard facts, Paul.
You contradicted yourself. I'm like, no. It's called you grow, you learn, you change your mind.
I've always got Josh to proofread my videos. He always points out.
Yeah, I do. You're welcome.
Oh, well, that's because Josh is an expert troll. Josh is the guy that's looking for the chinks in the iron. His many years of practice of attacking people on social media.
You want to know how many times? You want to know how many times I proofread my YouTubes? Never. I just release them, mistakes and all. I don't care. You can tell.
This is why I don't do lives very often, man. Because I'm just like, usually with the Q&As, I go back through and I double check everything and make sure that I got it correctly. And you got to have a big set of balls to do it. I have been doing some live Q&As lately. Yeah, thank you, Tina. I thought the Serostim one was pretty good too.
Yeah, I did too. I like that one.
Yeah, it was good.
When you actually go through and look at the clinical trial and see the Bluntforce Tanya, so she muted Josh.
See, what I would do is I would read her comment and intentionally say the exact thing back to her and pretend she said the opposite. It was so mean.
That's why I have you on the show, Josh. I want you to be my friend, not my enemy.
Right.
That's a good idea.
Friends close, enemies close.
Embrace your enemies.
Yeah.
Keep them close.
Can't beat them, join them.
I want him on my side. I want him going after people for me. Yeah, it was interesting going through and actually looking at the stuff and how just how many misconceptions and incorrect assumptions people have about growth hormone. What was really wild is you go back through and look at now they have follow-up data because it was approved in 1998. The phase 3 clinical trials, I think, were from like 97, 96, 97, something like that. But like the whole organ growth thing, they're if you look at the FDA data, I think it was from 2019, 20 years in. It was a little 20 years in. There was 0 reports of organ growth from Serostim at 18 units a day. 0.
Yeah.
I mean, we can all take a guess at what the top reported side effects were. It was insulin resistance was a serious concern with growth hormone, and then it was the peripheral edema and carpal tunnel.
Right.
Was the second most common side effect.
I don't know, but like the idea that insulin resistance, right, is that's what it's doing, right? So there's HGH receptors on the adipose tissue, and where and so we're forcing them into lipolysis when it binds. So then we're increasing free fatty acids. One of the things free fatty acids does is it decreases insulin production. So it's more like we don't have as much insulin, but that's the idea. We're supposed to force ourselves into ketosis, and that's what HGH's major benefits. So
Yeah,
I don't know about insulin resistance. It's much that we're knowingly reducing the amount of insulin that we're producing.
it's a temporary effect because you have a rise in glucose from the shift to lipolysis. But what ends up happening, and I think where guys screw themselves, and this is just from what I've deduced from looking at it and talking to Kurt about it, is these ding dongs that are splitting it up into 4 doses throughout the day, and then you're in lipolysis all fucking day long and smashing a bunch of carbs, and then guys are taking Lantus and shit like that to deal with it, and more insulin equals more insulin resistance, and then you just have this downward spiral of I literally have seen dudes come out of contest prep with fasting glucose levels 150, 140, 150, 130, you know, in those ranges, and most often I think it's from splitting up the GH doses.
Yeah. It makes sense. It's just be cognizant that you're not producing as much insulin. So just be cognizant of that with your diet.
Well, they're growth hormone and insulin are counter-regulatory. Yeah, it was just really interesting, and what was even more interesting is the dosing protocols. How they dealt with it was nightly dosing, because the lipotic effect seems to tail off after 6 to 8 hours. So you take it when you're in a fasted state. And then, like, in people that had rises in glucose levels, they went to every other day dosing protocols, and that almost completely got rid of it. And the peripheral edema on top of it, and had very little decline in effect, which was interesting. That the every other day, and I don't ever hear of dudes are usually dosing it more frequently. They're taking it 4 or 5 times throughout the day, thinking they're getting a better effect from it. And it seems like if you want to reduce the side effects from it, the protocol is every other day dosing, because the rise in IGF-1 seems to last 48 to 72 hours after you take the drug. So really, that's what we're trying to leverage for the most part. It's a really shitty fat burner on the surface. We have other tools that are better at fat burning, GLP-1s and all the other things that we have now.
And then in my world, like, if you get that insulin resistance, all tendon like outcomes are trash. Like any research on like Achilles tendinopathy, you have insulin resistance, poor blood sugar regulation. That's terrible. But people go, oh, well, I'm taking it, so it's helping my tendons. But in office, when people take it multiple times a day, they're not checking their fasting blood sugar, which blows my mind. They start doing it, they're always way elevated. And then if they choose to do every other day or only before bed, watch that go down, and my shoulder bicep tendon issue or my tricep tendon issue starts feeling better magically. Ta-da.
Yeah, I mean, insulin resistance greatly affects wound healing. I mean, it's a huge thing. Like I know that because I'm a diabetic. There's the bingo card. You can punch at everybody on the. But last year, I wasn't paying attention and wasn't taking my insulin like I'm supposed to, and my A1C got out of control, and the surgeon wouldn't do my surgery until I got my A1C back down at least down in the 6s. He wanted to wait until I got my A1C under control. I also found out that it's great for infections too. That infection I had on my finger, the doctor told me that anaerobic bacteria, I think is that correct? Amy, you would know. Anaerobic bacteria are worse in diabetics, so the growth gets out of control. So, or if you have high glucose levels.
Yeah. There was a question while we're still talking about the Serostim study from Lucas asking if they reduced the dosage.
Nope, it was the full 6 milligrams.
Yeah, they kept it. They just changed. They just did every other day, not change the dosage too.
Another one that people called me out on is I said that it comes packed with sterile water. They do have a multi-dose version that comes with bacteria static water and sterile water, and I said that they use the bacteria static water so it doesn't degrade, and the guys were like, oh, that's not why, it's because of bacteria. And I'm like, what do you think fucking bacteria does to amino acids?
Breaks them down.
Yeah, put a piece of chicken out on the countertop and watch what happens to it. And then if you want to experiment, put it in a vat of bacteriostatic water. I bet you it doesn't break down. There you go. So that's what bacteria does to amino acids.
That's good information.
Yeah, I thought it was very interesting. I've been trying to do these things, more for my own education, but I like reading studies, and I sit around and I'll read studies and prescribing guidelines and things, and I figured, shit, I might as well just read through them and do a commentary while I'm recording a video, since I'm doing it anyway. It's something I just do for the fuck of it anyhow, but I thought it was a very cool, but the prescribing guidelines on it were interesting. It was 4, 5, and 6 milligrams, and if you were on over 121 pounds, it was 6 milligrams daily, which is 18 units per bros.
God.
Okay.
What was the
Carpal
first
tunnel?
what was the first weight class, Paul, for the 6 milligram? Was it the lowest milligram dose?
The lowest milligram dose, I think, was like 80 pounds and less. So basically children, 4 milligrams, which was 12 units.
Gotcha.
Yeah.
Wow.
Yeah, 12 units was the lowest. Now, keep in mind, these are people with cachexia, wasting disorders, and and compromised immune systems. It's not a one-to-one translation to bodybuilding, but this whole thing about dudes worrying about organ growth and all this other stuff. I mean, there is some reports of acromegaly over long-term use. I mean, we know that in the bodybuilding world. My hands have gotten bigger. I mean, the things that continue to grow as you get older: hands, feet, nose, ears, head. I mean, it will accelerate the growth of those. That is for fucking sure. You can look at anybody that's been bodybuilding for a while and see it. The GH horns. Why do you think I wear a hat?
Same.
Well, my hands are definitely bigger after some years of growth hormone. That's for sure.
Yeah.
I'm actually right now considering going up a shoe size.
Really? Wow. Wow.
I already wore size 15s when I was 17 years old. So
Paul's out of feet space.
Paul, that your nails and hair grow faster too?
Much faster. Yeah. Well, I don't have any hair on my head, at least, so I can't. I can tell you my back hair grows.
Right, back hair is amazing, right? So resilient. Blades must be sharpened daily.
Yeah, the nail texture is crazy too. It's like super hard. They become like adamantium claws.
I have to use toenail clippers on my fingernails.
Yeah.
And then when I dry needle folks who've run it a lot, their skin is so much thicker. Like
it does get
like
thicker.
I'll have to get like special needles, not just for muscle mass, but like, okay, one, as you lift like thoracolumbar fascia in the low back, that gets thicker. If you're super strong with deadlifting or RDLing, then you add long-term growth hormone use. There's times where I'm like, I swear these needles are harpoons just trying to break the skin. Like, good God.
Jeez.
Now, I will say this. I've barely touched growth hormone over the last year. I used it a little bit post-surgery, but I just took a break from it just to make sure that my A1C and I've been really trying to be healthy this last year and a half. It's funny, like people are telling me my nose has gotten bigger. My diet's been a little questionable. I was good this week. I had one really like gnarly cheat meal last night, but I did get mostly back on track this week. It's pretty much a chicken and rice week.
Right. Bland chicken, bland rice. Yeah. That's okay. I know why. Understand.
But I barely used growth hormone in the last year. Maybe 2 months out of the last 12 I've used it.
No, it's been great seeing the health numbers be like amazing.
Yeah, I've been trying to take a break from everything. I like, even right now, like I've been responding really, really well to 300 tests and 150 primo. Been getting stronger. My shoulder's getting stronger, and I figured there's no reason to push it until I get stuck. So that's kind of what I've been doing. Speaking of the bodybuilding craziness, Jason Love passed away this week.
Yeah.
Yeah, I saw that. I don't think there's been, at least not that I've heard. I don't want to pile on this, and I want to be respectful of him and his family. I think there's too many vultures out there that try to use it for social media clout. But from what I heard, he just collapsed when he was working out. To me, which would probably be some sort of acute cardiovascular event, which is we all know is the biggest risk that we take in the world we're in. And then genetics play a role in that too, especially when I see a guy in their 30s. You know, if you have a genetic predisposition, and I try to pound this into guys' heads. This is one of the things I really try to pound in their heads. If you have a genetic predisposition to hypertension, dyslipidemia, you know, you have any history of strokes, heart attacks, clotting, clots, or
like clotting disorders or clotting mutations too, whether it be factor V or thrombin or antithrombin mutations. But here's the thing, like so I just recently was talking to a patient, a newer patient. She came from a different clinic, and she had a stroke. She was only in her 50s and she had a stroke. So she immediately came to me and just kind of told me the story, and it happened not too long before that. So I immediately, you know, all the research is showing us that HRT doesn't cause it, because she was on HRT and the other clinic freaked out. And I said that, well, you have to get tested for all the clotting. There's got to be a clotting mutation in here. So sure enough, she had her test, and sure enough, she had two clotting mutations. The question that I ask now is, why aren't we it's not that complex of a blood test. Why aren't we testing everybody for clotting mutations? Everybody should have that test.
I have guys get it.
Yeah, blood panels. Like, because we could have adjusted her protocol and made sure, knowing that she had a clotting mutation, we could have, you know, made sure that we gave her ample omega-3s, maybe daily aspirin. Maybe there's things we could do, right? Protocols we can run to prevent those clotting. Why doesn't everybody have that? So that's exactly what we're going to do too. We're going to have, you know, the MTHFR genetic test. We're going to have all of these clotting tests, and we're going to, you know, offer it as cheaply as we can, so that so people can
smart
about this stuff. It's just crazy that they don't do this automatically.
Yeah.
Yeah, he said, I don't know why bodybuilders don't have a cardiologist. I have.
Yeah.
He tests me for everything multiple times. Yeah, I mean, you know, and I think the thing is, part of it is guys under 40, they think they're invincible a lot of times. And Ryan, I mean, just as simple as just checking platelets. A lot of times, like, people with clotting disorders usually are going to have high platelet counts. Yeah, you don't even, you know, you know, it's funny that people don't pay attention to that. And you combine that with high blood pressure, increased hemoglobin, hematocrit, and red blood cell count. I will say this, since I've seen the uptick of people using equipoise and the shortage of Masteron and Primable, I've seen some pretty gnarly red blood cell, hemoglobin, and hematocrit numbers this in the last. I've been doing a lot of fucking consult calls the last few weeks, and I've seen some guys that have hematocrits up close to 60.
Yeah.
So EQ's been good for you.
Yeah.
Ryan, Larry had a question. He just logged on. Forgive me if you covered this, which we didn't. Are these genetic test things going to do things where we need to do a 23andMe and send you the results?
No, we'll have the actual genetic testing. I don't recommend 23andMe for anything, because they use this really, they use a type of genetic testing that is really inaccurate. So it's really not, the 23andMe is really not good data. So like we've partnered with a genetic testing company, and they're kind of white labeling our genetic testing, and they've really taught us a lot about how to really do this right and to do it accurately. So so you would just come to our site, and we're developing it still. Right now, we just have one set of genetic tests, but we're going to open it up to just a whole, all different kinds of genetic tests from everything that you could possibly want, including some of these genetic predispositions that we're talking about.
Wasn't there some scuttlebutt about some fraud or just some pretty shitty practices at 23andMe?
It's borderline fraud because of the lack of accuracy. Like, some of those tests are like seriously like 18% accurate or something. Like, it's really bad. And people are just getting bad information and taking it as gospel because it's a genetic test.
Right. 23andMe, I think, is the one that asks you where you're from and then gets your genes and then tells you what other people said they were from, and this is what you're related to, right?
I'm sure, I don't, you know,
I feel like it's that stupid.
Exactly how it works. I know that the genetic testing company we're using went on this whole diatribe about how fraudulent 23andMe is, and he was explaining why, like as he was explaining all the genetic testing that they're going to do for us, and it was pretty interesting.
They got in trouble too for holding on to your so if I got a 23andMe, I'm supposed to be able to go in there and permanently delete all that information if I want to after I receive my report. And then but what's happening is they weren't fully deleting things as well. They were holding on to a copy and potentially have the ability to sell it to other companies, so they know how to, you know, develop products for your genetics or medicines or whatnot. So they had a little bit of a fraudulent issue with that, or ethics issue, from what I understand, which is no good.
Yeah, I'd heard some shady stuff about them. But back to the Jason Lowe thing. I mean, just some low-hanging, no pun intended, sorry, low-hanging fruit. All respect to him. The things that you can like just look for, like Brian was saying, clotting factors, looking at your platelets, keeping a close eye on your hemoglobin, hematocrit, and red blood cell count, watching your blood pressure, you know, managing your lipids. That's one that drives me nuts. Is there's just so many people that just completely ignore their lipids. Just like, and especially like these bros that are doing keto diets and carnivore diets, and I've seen some crazy. So I literally had a guy I did a consult call with that told me his previous coach told him to stop taking his statin, and the guy ended up having a fucking coronary artery blockage like 4 or 5 months later. He had genetic dyslipidemia. There's genetic testing for dyslipidemia too. I have genetic dyslipidemia. That's why I aggressively treat the you know, and if you don't, then you're probably fine. I mean, it's not that cholesterol is a guarantee of having a cardiovascular event. It is a factor in the equation.
Yeah, and absolutely right. Like if we're being careful, we have to look at these things. But like just like you just said, Paul, like one of the problems is that increased LDL can also mean metabolic flux, right? Like especially if you're enhanced, if you're building muscle, every muscle cell wall requires cholesterol, so you mobilize it through your bloodstream. IGF pathways and mTOR pathways exist on these lipid rafts that are based in cholesterol. So we need cholesterol as we're enhancing, as we're building muscle. So a lot of people are going to have high cholesterol. It's not necessarily a bad thing, although so there's some other things that to keep an eye on besides like again, I understand like not letting it get too crazy, but there's cases when you're going to have an elevated LDL and that's not a bad thing, right?
Yeah.
Saying so like some things I like to look at better is there's some markers that we can look at. I actually wrote these down because I'm going to do we're going to offer this test as just extra. Let's not just say, okay, well, you have elevated LDL, bad cholesterol, right? I hate labeling that, because if you have zero cholesterol, like you're going to have problems, right? So cholesterol is very important. It has to mobilize. We need it for, as I said, cell walls, mTOR pathways, IGF pathways. But to get a little more accurate, there's some tests you can take that measure the inflammation, because what we're looking for is the inflammation inside your arteries, right? And that's when we're going to deposit LDL and it's going to start to calcify. That's going to be the problem. So to measure the inflammation inside the arteries, MPO, myeloperoxidase, MPO is a marker that it's just a blood test you can do. LPPLA2 is an enzyme showing inflammation in the vessel walls. Microalbumin creatinine ratio can show early signs of blood vessel damage. So like some of these, like, you know, get your cholesterol, also get some of these. And plus the CAC and soft plaque scores are now, it's getting more affordable to actually get these.
Yeah,
we can
$100
look inside our arteries, right? And see if there's actually a problem developing. So, I mean, all of these tests can help rather than just guessing just because our LDL may be high, right?
Yeah, I usually have people check ApoB as well.
Well, what is it like? 1 in 250 people have a form of the genetic disorder. If they eat a bunch of saturated fat from carnivore or keto, their lipid panel becomes a mess. And I'll have people lose weight going on carnivore. We check their lipids and they're, you know, like 600, 700, yet they're losing weight, which you would expect to go down. I'm like, you've got to get off this, or you've got to get on a statin. But your body's telling you, you cannot process saturated fat in those amounts. period.
Yeah,
they're suppressing that info in carnivore in particular. I feel like I'm like, that's just tell people, check your blood work. This diet might not be for you, but heaven forbid you give context.
I have genetic dyslipidemia. I had it checked. You can go to your cardiologist. They'll do it. With insurance, it was a $20 copay.
Nice.
Got to check. So like keto, I have to run low fat diets because of that. My body makes way too much cholesterol on its own. So I have to be really careful with it. And I have a history of strokes and heart attacks in my family. So it's just something I have to pay close attention to. Yeah.
Now, question for the go ahead, Paul.
I was going to say, God rest Jason's soul. We don't know what happened, but if I were to guess, it was probably some sort of clot or something acute like that would be my guess.
My apologies if you guys talked about this last week, but
what were you going to say, Marv? Sorry, interrupt your mic.
Oh, I was just going to ask, like, for the panel, like baby aspirin, nattokinase, like what are your guys' usually, like, what do you do? Is it based on genetic testing first, like baby aspirin, and then bring in natto if they have something, or how do y'all approach that?
I would do high omega-3s, nattokinase, baby aspirin, and then if you have the disorder, if you had genetic mutations at a certain age, we're probably actually want to maybe start thinking about Eliquis, right, which is a medication blood thinner. Like, I mean, there's at a certain point there would be no reason not to get on that as well, just as proactive. Oh, yeah.
If you can find ways, like, that's why I like what you're doing there, Ryan. If anything you can do ahead of time for screening and getting a better idea of what's going on under the hood with an individual, because we are individuals, you're not going to know who has a lipid issue genetically until you test it anyhow. You don't want to find out the bad way. So this gives people, a kind of like peace of mind, as well as gives you the tools to kind of serve that patient only better.
Yeah,
and then
we can adjust
you have the screening, you have all these options, you have a better direction of where to point the compass to address these things. So, I mean, Dr. Marver, for me, it depends on the scenario with the person. I have to do as much looking into their individual situation first, and go from there.
Awesome.
If we have all this information, we can adjust your protocols to be preventative.
Right.
Yeah.
In lipids especially, I find that sometimes they're not an easy fix. You get your lipids out of whack. It takes time, and it takes consistency to get those things back in line. And usually it involves things that you don't want to do as a bodybuilder.
Running
like cardio and eating a diet.
Yeah. You know what I mean?
I will say this, the GLP-1 drugs have been I got more lipid lowering effect from running retatrutide than I did from running a statin.
It's crazy.
I've had better blood work with my lipids specifically. That's been one thing that's been tough for me to manage myself. And Retta did more than anything I could have came up with over the years. And I've tried real hard, just basically to mitigate the damage I'm going to do when we go through the show preps and we go through the bulks and all we put ourselves through.
Well, that shows you how profoundly it affects metabolism of glucose and lipids through the liver.
Yeah.
And it doesn't seem to be, I've been on tirzepatide prescribed by my doctor, and it doesn't seem to be as effective at it. So it has to be the added glucagon agonist that has the.
Yeah, it does the
effect.
recycling. It's like turns whatever, it does like a triglyceride into a fat, and then back and forth, and then it also does that with glucose and glycogen. It just burns some extra calories for you, and it seems to scrub the liver clean.
Specifically, the increase in hepatic lipase. So now it almost reverses fatty liver disease. Like
it does.
It does. Yeah,
almost.
Really,
so we're just ripping apart fat with the increase in hepatic lipase. It's just crazy.
Yeah, it's pretty fucking crazy.
Yeah. You kind of throw fuel to the fire because you're probably taking that GLP-1 and you're starting to diet. You're starting to, increase energy expenditure, cardiovascular output.
I just have run into, I do tons of these blood panel reviews. It's crazy how many people I get to come to me for blood panel reviews. I did 17 this week that come to me, and in the trends that you see, And look, I'm assuming the people that are reaching out to me are the ones that are scared and have problems. So it's probably I'm seeing the worst the guys that fuck themselves up and they're coming to me. But I've seen just some crazy shit, man. Guys with blockages, guys with kidney damage. I've seen some insane stuff. But I go back to it over and over and over again. If you're going to run PEDs, managing cardiovascular risk is probably. I'm not talking about like TRT level stuff. We know that that's probably safer, but I'm talking about like the crazy shit bodybuilders do. That you gotta know what's going on. You got to know your genetics. If you have a genetic go back to the growth hormone thing. Like I looked at that phase 3 clinical trial study, and they advised that if you're a type 2 diabetic, that you probably shouldn't take growth hormone. Or if you had genetics for type 2 diabetes, you probably shouldn't take it. Knowing your genetics, knowing where where things are. A lot of these things could be prevented. I know of several guys that have died from clots. Several. Another thing that concerns me with the clotting thing too is I know there's an old school bro mentality of running tamoxifen year round. I have to wonder if that doesn't play a factor in it too.
Yeah. Yeah. I don't like blocking estrogen receptors. It's supposed to be tissue specific, but we find that it's not completely tissue specific, and we're blocking them in the brain, blocking estrogen. I just don't like blocking estrogen receptors for anything.
I mean, tamoxifan's been has a pretty strong correlation with clots.
Yeah.
Mm-hmm. And then you remember back in the day, Ryan, everybody ran it year round.
Yeah. Oh yeah. It was part of your protocol. Yeah.
Dudes just ran it year round.
Yeah.
Which is insane to me. Especially if you have a clotting disorder. Yeah. All right, change the topic. Have you I want to get out of the morbid territory. Auto Classics coming up. I saw Kai Green talking some stuff. He always seems to do this. He likes to stir up the rumor mill that he's coming back. There was some scuttlebutt about him coming back for the Arnold this year, but I mean it's been 10 years since he competed. I mean, he looks like he could compete. But I did see Andrew Jack post some pictures. Holy shit, that dude looks fucking crazy, man. That guy looks. I'm gonna pull this picture up. The hell, why is it not letting me? There we go. Share screen.
Is he still training with? I forget who was helping him right before the Olympia the last few weeks. Is he still training with that other pro?
Hottie?
No, somebody else. He was training with somebody else the last few weeks that Chris Osita was saying. So I'm wondering if he was.
Oh, it might have been Kamal.
Yes, it was Kamal. Is he still training with Kamal?
The video that he had up, he was with him doing legs with Kamal.
Yeah. God damn.
Kamal trains down here on MI-40, so maybe he's still down there. That's where these pictures are from.
Yeah, that's what it looks like. Kamal you talk about a guy that if you want to see how to lift perfectly, watch that guy lift sometime. Mm-hmm. His execution is just flawless on everything.
Yeah. Just for being picky sake, do you like the way he hits this front double, Paul?
No.
I think so.
Nope. He can get away with it though. When you're as big as he is, you can do the front double like that. I hate everything about that front double.
I agree. It's awful.
It's I'm like, dude has to have access to a posing coach.
Yeah.
Mm-hmm.
I mean, he's trying to change the game, guys.
Guess so.
Is he just not listening? And I don't say this to be an asshole. I feel like I beat this guy up every time I see him. It pains me to see a guy that could be winning shows lose because his posing's terrible.
Yeah. Exactly. I mean, that's really it. I mean, it's not the physique you have, it's the physique you show. And I look at this and even little tweaks in like the foot placement. I mean, there's so many, and I am, obviously I don't pose men, but it's those little things that can just make such a difference.
The bow legs, he's got his arms up too high, he's leaning back. I mean,
they're just awkward.
Yeah, it's yeah. Yeah,
I'm fully convinced he's got everything already. Last Olympia, he had everything he needed to win the show. And
I think he's the most gifted bodybuilder.
Yeah.
Genetically.
Yep. You look at standout body parts. He brought the conditioning for once that was comparable to the top fives, and he's got everything he needs. But it's not just you. It's not just this podcast. It's everyone's been telling him that, your posing is noticeably something that needs to be improved. And I don't know that if that was my only feedback, it'd be my highest priority.
Yeah, I mean that's literally what's probably what's separating him from being Mr. Olympia and being 3rd or 4th place.
Sure.
Yep.
This is posing.
Yeah, because for me, my eye kept going back to him at the Olympia. Like of all the top guys, my eye kept going back to him.
Yeah,
I like his physique the best.
Yeah, physique is incredible for sure. I mean,
I wonder too if it's almost like with his posing, he's got such an amazing physique. There's nothing he has to hide. There's nothing he has to put effort into necessarily hide.
Right.
Like his waist, like only thing could happen is if he puts on a little bit too much size, he could blow out his waist. But as of right now, he doesn't have to pull in his waist. He doesn't really have a bad angle. His side chest gets knocked on a lot, but it's how he poses it. There's nothing wrong with the physique. Yeah. It's interesting. I don't know why. Hopefully he doesn't figure it out when he finally blows out his waist or something, and then he has to pose strategically, which is not easy.
Talk about looking crazy, man. Nick. Jesus Christ.
Wow. Man.
I love Nick. I'm a huge Nick. I'll be the first to admit it. I'm a Nick fanboy. He's just a chat with him once in a blue moon, just rarely, we message each other, but he's just such a humble, hardworking guy. He's a bodybuilding nerd. He's just another bro that just loves doing this stuff.
Mm-hmm.
So my world is helping people posing better with some targeted exercises right before. For any side shot, everybody could try this right now, especially for any twisting like we just had Nick. Get a foam roller or yoga block. You're going to lie on your side. Everything is stacked. It's right at nipple height. You're going to breathe in through your nose, out through pursed lips. I do 10 breaths before training or posing. If you have mid-back or rib cage pain, lie on your side for 3, 4, 5 minutes. This is as close to an adjustment as possible. But as we get bigger and stronger, I forgot my ribcage model, and it's the winter apocalypse in Texas, so I'm not driving. But we get compressed front to back. If you lay your on the side, that'll expand your ribcage front to back, so you can start to twist more. So not only will shoulders help your side shots, you'll gain 3 to 5 inches of width just from a little bit of breath work, getting the ribcage moving. And then there's other things you do for rotation, for front relax, double back based on other things. But everybody could try that now is foam roller yoga block before training, before posing. On each side, everything stacked, 10 breaths. And the more you do it, the better it is. But you will immediately gain more rotation. You'll be able to leverage back more. So rib cage is what most people miss, and rib cage will dramatically improve posing.
Is that going to help with getting more flexibility in that upper thoracic region?
Absolutely. Yep. And then there's pelvis stuff too. Yep. So I'll have my patients or folks I'm helping, with consult stuff of this is what you do, during the season, but then obviously backstage, you're not going to get on the ground. Right. So you have different things, but you want to get the rib cage
all over the ground
as soon
backstage.
as possible. Yep. So some people like it, some people don't, but everybody should try it. It's pretty remarkable. The more you do it, the better it gets.
I've been doing it.
So have you noticed the difference, Paul?
Yeah. I've been incorporating a bunch of the stuff you showed me. I've actually been taking some time to warm up. I've been doing dry needling. I've been getting massages, all this shit that I ignored for years.
Hey, it's a miracle. Wow. But rib cage, people don't understand it. Rib cage is a driver of your upper body for biomechanics. Foot's the driver of your lower body, and unfortunately nobody looks at either. But like what Amy was saying, foot pressure changes posing, which we all know, but the average person doesn't.
Yeah. So Dr. Mark, sorry, Paul, can I ask him a quick question?
Yeah, go ahead.
So one of the things I would do a lot with, I would take a broom handle or like a a PVC pipe and get it like right up underneath my lats and lean into it. But with this, you're trying to hit more of the rib cage with the foam.
Yeah. So you could put the stick there and release your subscap.
Yeah.
If the subscap's tight, you can't flare out. So when I went on Paul's, I showed Sean Carita because, you know, one of the greatest bodybuilders of all time, he was super bound up, uneven side to side. So do that first, do your own tissue work, and then you're laying right at nipple height, the middle third of your rib. So you could do your tissue work first with a couple passes, open that up, and then get a little bit lower, and then you're just breathing. So it's people are like, that's it, but it's remarkable what you could do with that.
Awesome. Definitely gonna add that in.
I wanted to show something real quick with Nick that he does excellent on the side chest that I see a lot of amateur bodybuilders don't do. This is the twist, like Mar was talking about, being able to get that twist and open your rib cage up. But you can, one of the things, like if you can't see your back shoulder on the side chest pose or side tricep, you're not twisted enough. You're going to make yourself look narrow. I see a lot of guys that just are straight on, but you can see how that back shoulder is visible from the side chest. You really have to crank and be able to, you have to have some flexibility and mobility to be able to do that, first of all. But his chest is high and he has his, and also like the grip too. That's another thing too. I noticed with guys, like guys want to clasp their hands. It's not clasping your hands. You have to grab your wrist. If you notice like how he's grabbing his wrist, just a little nuance on the side chest pose.
And it works for however big you are. Cause it has worked with, you know, I helped an Olympian with that, and we gained, like, no joke, 4 or 5 inches. We're like, he was shocked, both side try and that. And he's like, what the hell? It's all rib cage driven because these guys are so big. Compression of the skeletal system is how you generate strength, right? And expansion is how you generate mobility. So obviously you don't want to take away all compression, but you get the right areas. It's insane. And then I've actually had smaller folks, so not, you know, 300-pound guys, but smaller folks, they start over rotating on the side. I'm like, okay, just because you can go that far doesn't mean you should, right? But that's a good problem to have. Most people can't rotate enough.
I think that is one of the best poses, though, because he's able to stay so upright in it, which I think keeps it so visually appealing, whereas so many guys end up like really tilting down into that forward-facing arm when they do it. But with Nick, he really does stay more like upright, so it looks way more like statuesque and like a confident pose versus like, I'm just getting into this.
Yeah, very true.
I'm going to try to find the one of Andrew Jack doing it just as a contrast to show you how he makes himself look smaller.
Find 2 better examples to contrast, really.
I'm trying to find a way to open this image.
Did Andrew beat him in the Olympia?
Yeah, but it was conditioning. It's a conditioning thing. Look at this. This is how you don't do a side chest. See how narrow? I mean, he's a huge dude. Look how narrow he makes himself look.
He's just trying to make it easy for the other competitors. That's all.
He throws off his balance.
You're a good man, Andrew. Oh, sorry.
See how he's clasping his hands. He's hiding. His chest is like caved in, and he's not showing that back shoulder. Zero twist.
I'm starting to think this guy just does an imitation of bodybuilding, like he's mocking everyone that does it. Like I think I found out his game. It's pretty funny.
Yeah, you know, Ronnie Coleman was terrible at posing. He was just so damn big. It didn't matter.
Nobody.
Andrew's close. He's close.
Hey, on other like kind of like unusual, funny bodybuilding type news, did you hear about Ramondino and his neck tattoo?
No.
Oh, was the lion, right?
Yeah. So he apparently put something on IG or something where he's like, you know, like, hey, I really would like to get this neck tattoo, and apparently, if you say that, people go crazy. I don't know why, but apparently he would be the first, I guess, Olympian with a full-on neck tattoo or whatever. And it like everything else, fans that we are, we overanalyze everything, right? You know, we make it way deeper than it has to be. But there was some interesting reaction regarding that. There you go. Yeah.
It's a terrible neck tattoo.
And that's the other thing. Like, the other thing is like, yeah, you could get one, but get a good one. Get something decent. Anyway.
I think he likes to stir the pot though too.
Oh yeah, I mean, it gets clicks. That's for sure. It
It was hilarious when I was at the Arnold last year watching the finals, and I realized it was him sitting right behind me with his girl. Yeah, it was.
What's the worst thing to tattoo as a bodybuilder?
I mean, anything that'll hide your physique, right? Like if you're
Back, maybe.
I guess.
Back, chest
Even your
tattoos.
arms. Like I'll tell you something. I have one, and it's definitely not as visible like what's going on underneath there as it is on the side that doesn't have it. So
I disagree. I wish I never got my left side tattooed. I do all my side poses on my right side now.
Yeah.
I think a lot of people end up doing that. Like they pose on the opposite side of their tattoos.
Yeah.
I mean, especially like for women's categories. Like if you have a lot of tattooing, like up on your hip or onto your glute, like it can make you look unbalanced when you're looking at somebody, from the back pose. If they have a lot of ink on one side, it can be a little bit distracting.
Yeah.
I think overall, I mean, as long as it's not distracting to the physique, they're not going to mark you down for tattoos as long as they're not distracting.
Yeah.
They
And the
have
other thing
cover up,
with
they
a good
can do-
tan, right? You can definitely, like, it disappears a lot. Like, so there is that.
Yeah, the cover up at work, I mean, is very person dependent. I think if you're trying to cover up a small tattoo, it works really well. But if you're trying to cover up a large area, it can mess up with the tan going on, and it can be more problematic.
Yeah, it doesn't look the greatest.
Yeah.
On a Comedy Central roast, Jeff Ross told Mike Tyson about his face tattoo. He said, "Of all the faces you've bashed in over the years, the one you fucked up the most was your own."
That's a ballsy thing to say to Mike Tyson.
Yeah.
Although I think he's smoked enough weed at this point, he probably doesn't care.
Well, they could die for you if you got enough money.
Yeah. Well, just stay out of range, right? Just stay out of that. Stay out of punching range.
Do we want to get some questions in? If you got rehab questions, we got Dr. Marv here.
We have tons of questions. Are you guys ready?
Yep.
All right. We covered this one kind of while we were talking about it, but he asked it a couple of times. How do you think it's the best way to manage cholesterol, specifically LDL?
Running.
Cardio and a diet is probably the simplest thing to do. I mean, everybody's different. I mean, it's, and like we said before, high LDL is not necessarily mean that you're going to have a cardiovascular event in combination with other things, inflammation, high blood pressure, all this other stuff. But I would say, just as an ounce of precaution as a bodybuilder, you probably want to keep it on the lower end.
Do those other things. Do the blood test to test the inflammation inside your arteries and veins, and get a CAC and a soft plaque. Get both of those. Like, you can really keep an eye on it that way.
Yeah, my CAC and my soft plaque were both 0, surprisingly. Even with the dyslipidemia.
You take really good care of yourself, Paul. So
I don't know about that.
You're very you really look into these things. You really focus on keeping all the inflammatory, what would inflame your arteries. You are very careful to mitigate all of those.
Is 3 grams of gear on contest prep safe?
But you also mitigate that with all the all the testing
You
that you
didn't
do
die.
to mitigate. And
In my defense, I've been on 300 milligrams or less the last year.
The other thing, for what it's worth, some of the best blood works I've seen with some of my clients is been people that have those small things as part of their lifestyles too. So some people look at it like cardio is cardio, good diet. They look at those as small factors. If those are repeatable parts of your habit, part of your lifestyle, you just tend to have better cholesterol. I notice a very big correlation. So it might not be the biggest driver of change, maybe a statin works better or easier, it's easier to follow that routine. But don't overlook the little things, like Josh says, activity. Paul says good diet. It absolutely makes a difference.
Yeah.
Omega-3s, natto, citrus bergamot, all the over-the-counter stuff too.
Yeah, if you guys want, I have a cholesterol lowering protocol up on my website. You can download it for free. But I would start. There's a bunch of just over-the-counter supplements you can start with that are on there. You know, the stuff that Mike mentioned.
Have any of you seen melanotan 2 reducing coronary scoring?
I haven't seen that.
No.
What is that about?
Interesting.
So, you know, I got to do the disclaimer: education only, not direct medical advice, because that's not my scope. I have had a couple people start running that, and then their CAC's starting to come back lower.
No kidding. That's really
I now so they did other things as well, but that seemed they were missing that. And
do you have an idea of the mechanism behind that, or why that would happen?
At one point, when I was trying to, I talked about it with Carl Lenore actually back in the day, and he's the one who kind of turned me on it. And then we talked about it, and then before I got a license, I could kind of be more open about this stuff, and had a couple people do it, and theirs came down. They also were doing, you know, like the K2. But like the data on K2 is mixed. Like people speak like it's an ultimatum, like it automatically. I'm like, we have meta-analysis that say it does and it doesn't, but it doesn't hurt to take it, right? And then, but I think it's like a lot of the sunlight exposure is kind of helping all that.
Really interesting.
So it's something to experiment with, and yeah. So see, and then if you're seeing that, yeah, please let me know. But I've 5 or 6 people, including myself, it seemed to help.
That's interesting. Amy, can we grab that caffeine and carbs question? That was one I know a little bit about, so I've had issues.
From Tom S. I've noticed I have a bunch of carbs and then caffeine. I go hypo. If I have protein or fat with the meal, it doesn't happen. Should I start monitoring my blood glucose? I'm on TRT and pretty lean.
It's reactive hypoglycemia. It's the coffee is going to dysregulate cortisol and epinephrine, and I can literally I'll see it with myself. I can drink, and I've been, now that I've been using a CGM, literally I'll take a low carb day where I don't drink, or yesterday I fasted and I had a cup of coffee. My blood glucose went up.
That's crazy.
Almost 200, and then came rocketing back. I'm diabetic though, so keep that in mind. But it was clearly a glucagon release and glucose dump from the liver, and then I went, you know, borderline hypo afterwards. So yeah, and it's and then sometimes what will happen is, especially if you eat simple carbohydrates on top of it, you're going to have this, your body will release too much insulin as a result. But caffeine can dysregulate glucose metabolism. It's so definitely could. I bet you if you didn't have that cup of coffee with your carbohydrates, you'd probably be just fine, or a little bit of fat with the carbohydrates. You'd be just fine. You know, 5-7 grams of fat added to it. Diabetic bingo card check number 2. The only reason I wanted that one because I've been looking into it for myself, and because I've had issues with caffeine and glucose spikes. And
you were showing me that on your glucose monitor, Paul.
Isn't that crazy?
I'd never seen anything like that. That was crazy.
Yeah, and I have run into other people that have had that issue. But it just shows you the strong stress response that I have to caffeine. I'm hypersensitive to caffeine. All right.
You guys probably test for those genetic markers that tell you whether you're a slow or a fast metabolizer of caffeine metabolites.
Yeah, what is it? The CYP, whatever, 40 something gene.
Yeah.
I have to learn.
It's one of
believe
CYP
450. Yeah.
CYP 450. Yeah.
Well, I also believe in the morning, you know, you have your coffee, you usually have your highest spike of cortisol right before you wake up, which will also lead to an insulin spike, so you get all these things kind of factored together. That kind of makes sense, you know, timing and just the cycle of your cortisol cycle throughout.
You'll even see it with guys on contest prep when they're low carb. They'll have rising fasting glucose levels, but if they get a CGM, you'll see how they what is it, the dawn effect, where you have that cortisol dump before you wake and you drop glucagon and then glucose. Now, in theory, the Retta should help that, or you could use metformin. to help with that. But you'll see it in guys on contest prep. Ironically, when you are low carb, a lot of times it gets even worse. You'll see it on contest prep often. Like guys, there are also the idiots that take growth hormone 8 times a day, and then wonder why the glucose levels are high.
All right, we're ready for some more?
Yeah.
Yep, we have a lot of questions, a lot of cycle questions. This one from John, running 600 tests, 300 MPP. Any suggestions or on adjustments or supplements to help prevent sides? He just started this week.
I do not like running nandrolone as a primary secondary compound with testosterone because of the increased aromatization that happens, and then estrogen amplifies the progestinic effects of nandrolone. I think a lot of times the side effects that guys get that they attribute to prolactin is because of the amplification of the progestinic effects of nandrolone from estradiol conversion that lead to a drop in dopamine, and then you end up with the high prolactin. So I like having something that's going to mediate estrogen, equipoise or primobolan, and then run it as a third compound. But that's especially at that much. Like if you're on TRT and you're running 100 milligrams of DECA or something, that's completely different. Ryan, what do you think?
Yeah, I agree that especially when you're running them in that amounts, Paul, I know you have some issues with nandrolone. I've just seen it be so beneficial, but not in these amounts. Just like you said, Paul, there's also evidence that nandrolone directly binds the estrogen receptor alpha. So you're gonna just like Paul said, you're gonna compound those estrogenic effects. So I don't like running in high amounts. I like nandrolone for just therapeutic reasons, helps with joint pain. The progestogenic effect can really be beneficial for a lot of people. When you run it in this high a dose, though, you're going to be asking for estrogenic effects. So just like Paul said, something like Primo or EQ,
or an AI.
Yeah, probably the easiest thing to find.
I'm also curious if you built up to that total, or if it's something that you just started like that, because you start cold right into 600 and then 300 NPP. You're sure it's going to have issues.
Yeah, just like Dave's saying too. Like, what are the specific sides? I'd like to know that, just so we can kind of help with what exactly.
What sides are you having, right? I just need like a list of like what you would have if you were going to do nandrolone. Like if I was going to do nandrolone, I'd have P5P, I'd have an AI, and I'd probably have 5-HTP.
I do really dissuade people from using the old school bro mentality of using Caber as a prophylactic, which is just incredibly dangerous because of dopamine agonist withdrawal syndrome.
Yeah, it's super. Caber is super potent too. Like you crush your prolactin, and just like everything, you don't want to crush it too far.
And coming off, sometimes I've run into guys that were coming off of it. It's they literally have withdrawal symptoms like you would coming off of heroin.
Yeah.
Just a reminder, you can't take SSRIs and 5-HTP together though. Because just making sure.
Serotonin syndrome will kill you.
Same thing with methylene blue. I've been making sure to tell people that too. Anything that's going to affect dopamine
or microdosing psilocybin.
Also tesofensine.
Yeah. But little input on the MPP thing. I've always had similar side effects that we're talking about here with even smaller doses of MPP. But on this last off season, running it up against 600 EQ, I got 300 MPP. I had none of those side effects, none of the mood stuff that I usually go through when I'm on it. So it has to be mostly estrogenic.
Yeah, the estrogen, from what I understand, amplifies the effect of the that it has on the progesterone receptor. And then that's what indirectly affects dopamine, and then you have dysregulated dopamine and then potential prolactin issues. It's not that it directly affects, but that whole cascade is what causes it. Basically, people just end up with fucked up dopamine from it. Is some people, not everybody. And I think that's why you see guys that'll run nandrolone only cycles and say they feel fine, because there's no really estradiol conversion going on since you don't have testosterone in the equation. Anyway, that's my thought process on it.
Well,
Okay,
I can
next
tell you,
one.
I looked back at my notes. I know I shared with you guys before. I'm using NPP now at a very low dose, but I have EQ to keep my estrogen in line. But when I looked back like 4 years ago to a cycle I had some kind of issues with, like feeling claustrophobic and anxiety, and it was all I was running was Test and Deca at the time. I didn't have really anything modulate my estrogen either.
God damn, I love Nandrolone for size. I don't think there's anything that puts size on you better.
Yeah, little goes a long way.
And your joints feel so good.
Yeah.
You might not be able to get a boner, and you might, have panic attacks, but damn, you get big and your joints feel smooth as butter.
I just want to say that in my vast amount of experience, like most people don't get those adverse side effects from Nandrolone, but some do for sure. So it's something to watch out for.
Yeah.
Except when you use in high doses though, like 600 and 300 is a little bit.
That's a little different between 100 and 700, right?
Yeah.
Yeah. 100 milligrams of Deco on TRT is not going to fuck you up.
Yeah, and that's where I see a lot of benefits. Right? But the high dose,
not
juicy problem.
No, I think it's when you get to 300 mgs plus is when you start running into issues, especially when the testosterone's high.
Right. Yeah. When you're combining it with the testosterone, that's the main thing because
yeah, it's dose dependent, like all things.
Mm-hmm.
I don't like to speak in absolutes on drugs anyway. What do we got next here?
Next, we have a question from Ergy Bear. I did try and get a little more refinement on what his goals are and did not get them. He said he's going to jump on Test and Anavar, about 280 pounds. Would it be recommended to weight or any recommendations? I asked him what his goals were. He responded with, where was it? That he works out a lot, eats a good diet, but I don't know if he's trying to recomp, gain, cut. I'm not sure what his.
Well, he's asking about recommended body fat before jumping on gear, so that tells me he's got some body fat to lose. If he's not on gear currently and he's 280 pounds, I doubt that it's muscle.
I've got the meme. He's literally reading the Anavar burns fat meme, and testosterone helps you burn fat meme.
Yeah.
But yeah, it's like
I would just.
You need to be on TRT. You should be on TRT. But other than that, if you're 280, you're probably fat.
TRT, some HGH, and a GLP-1.
Yeah, Paul's already said it. Like I don't we get that just because of the kind of the antiquated notion that Anavar burns fat or oxandrolone burns fat, like, and not that it doesn't, more because it's so anabolic that it increases your metabolism and you're indirectly going to burn more fat that way. But I wouldn't use it it's not a fat loss agent. Right. So just what Paul said, just get on TRT for sure. We need to change, we need to put you into an anabolic state instead of a catabolic state. And then we need GLP-1. Like we live in an era where the best medications on the planet for
coaching.
GLP-1 and testosterone, like Paul said, HGH should be fine too.
Or secretagogue, tesmorelin or something.
Save the oxandrolone for when you have a specific goal you're trying to reach, not fat loss. I
don't know what you think, Ryan, but I love Anavar, but you have from what I've seen, you have like a 6 to 8 week window you can run it before you end up with single digit HDL. That's what I've seen with most people.
And that, what a lot of people don't understand is the main problem is going to be your SHBG too. You're going to put that, you're going to crush that in the single
smash it,
and then you're going to have low SHBG problems, which essentially lowers the efficacy of the androgens in your blood. So you almost have low testosterone symptoms while you're on all this gear because your SHBG is just buried, and so that's the main problem, and that's why I say I mean, oxandrolone, I just think I don't think like there's like a lot of people say, oh, it screws up my liver. We have no evidence that oxandrolone actually does anything adverse to your liver. It increases your AST and ALT just because of metabolic flux, because when you're hypertrophying that much muscle, oxandrolone is 3 times more anabolic than testosterone. It's very potent. So when we're hypertrophying that much, your body has to pull energy from other sources, and you use gluconeogenesis. So your AST and ALT can raise. There's no evidence that it's actually long-term, there's any adverse long-term side effects to your liver. But we don't want to use it long-term for other reasons, like the cortisol inhibition. You're going to really reduce the cortisol transcription. You're also going to really crush your SHBG, which is going to cause problems. So just use it intermittently. Like I wouldn't even say don't use it daily for a while. Just use it like as a pre-workout 3 times a week or something.
There was an old study, you probably have seen it, Ryan. I'll have to dig it up and do a video on it. I think where I can't remember exactly, but I think they ran 50 milligrams with women and children on that study, and there was no significant no damage done to the liver.
No long-term consequences. Well, they actually have a lot of studies at it for burn victims and children. For children, when they have burn victims, you need to it takes so much energy to heal all that like melted skin that you'll actually atrophy your muscles. Your body will just use gluconeogenesis. So you have to get something anabolic or they'll eat their own muscle. Their muscles will atrophy so much. However, in children, you can't use testosterone because the estradiol will close growth plates. So you have to use an androgen that doesn't convert to estradiol. Oxandrolone is the preferred one that they use. And so there's a lot of studies with children. No adverse effects. 2 years. Kids, burn victim children using oxandrolone for 2 years and pretty decent amounts too. They were using up to 20 milligrams.
Yeah. It's 20.
Long term, 2 years straight, no adverse consequences. No long.
I was going to say it was a long study. Yeah.
I don't remember. Some of those old studies, the shit that they did was wild. Like the one I had up a few weeks ago with the 100 milligrams of D-ball. There's some crazy. Some of these old studies are crazy.
Back in the 60s when there were so many positive studies about all these anabolics, and
I just love the Serostim one where it's Serostim 5-2 split, just to show you how stupid that is. It's like, really? Thanks, guys.
They even did the 5-2 on the clinical trial and said that it showed no additional reduction in side effects. The every other day dosing was the one that they found to be the most effective when people had side effects.
Now, Ryan, just quickly, do you ever have a scenario where someone's too high a body fat percentage that you're kind of discouraged from wanting to put them on even TRT doses?
Not TRT
just for their aromatization.
Yeah, not TRT doses. We need to get you, like, contrary to what the medical community is, we've been inculcated that you're fat, therefore your testosterone levels will drop. If you can stop being fat somehow, then your testosterone levels will raise. And we don't see that in the field. When people drop their body fat, they do not lose, or their testosterone levels do not raise. Maybe a little bit, but like 10%. But my argument is that when they're eating better, your SHBG climbs, which means that your free testosterone actually stays the same. Anyways, so it's actually very important to get people out of a catabolic state. When you're obese, you're obese for a reason. One of the reasons, that lifestyle is one of them, but another reason is you're in hormone deficiency and you're in a catabolic state. Your body's using muscle mass as a primary source of energy over your fat stores. So we have to get you into that anabolic state, increase your metabolism. And I rarely see, I don't see a lot of obese people really have estrogenic side effects like people think. People think, oh, you're going to give an obese person, they're going to have estrogen and they're going to have all these adverse, these estrogenic side effects. And we just don't see it.
I mean, that was the line of thought, originally it was that estrogen. And then as you get leaner, you're going to have to consistently alter your AI dose or whatnot, or monitor your estrogen as you come down in body fat as well.
And that is true. Like people tend to handle estrogen better over time. And one of the reasons probably is loss of adipose tissue. So loss of aromatase enzymes, but we really don't see a significantly higher incidence of obese people having estrogenic side effects. And I mean, not any more than anybody else. You can, people can have estrogenic, people can be really sensitive to estrogen. But most people aren't. Estrogen is not that big of it's not in TRT doses. It's not that hard to manage. And if you have anybody guiding you worth their salt, they can mitigate estrogenic side effects really quickly. Yeah. And I don't even need an AI to do it.
Mm-hmm.
Bodybuilding doses is different. It's a little, but
yeah. Well, I was curious of your thoughts because that's always been one that I've heard people suggest is wait till you get your body fat down a little further before you start TRT. But that makes sense getting out of the catabolic state. I never even thought it that way.
The dopaminergic effect too, because like when we think about you're obese, right? And the whole the idea that just stop being fat and then your testosterone will raise and then we can put you on TRT. I mean, it's just backwards. They're obese. Yeah, they're obese because of two things: lifestyle and hormone deficiency. Like they're in this catabolic state. So we need to take care of your hormones. Of course, we need to change the lifestyle, but getting their metabolism right, getting them in an anabolic state, and the dopaminergic effect that testosterone gives people who were in a catabolic state. You want to go to the gym because you're having that dopaminergic effect. You're seeing the results from the gym faster, which is more dopamine, which makes you want to go back to the gym. I mean, you get an obese person and just put them through a boot camp and have them work out and suddenly eat better. They're not seeing results because, again, their hormones are low. They're not seeing any results, and they just want to go back to what they were comfortable with, what did give them dopamine, and that's donuts and fatty foods.
You are a wealth of information, Ryan. I've been sending everybody over to you that needs TRT.
Well, I appreciate it. Thank you.
Yeah.
You're doing the Lord's work out there.
I appreciate it. We're trying. Yeah, we're growing really fast too, but I appreciate
Weaponized autism, Ryan Root.
No. I mean, it's just awesome that there's
Great. Yeah, no, I learned so much from Ryan. You have no, I mean, just amazing.
It's awesome that you're out there doing what you're doing. We need more people like you. You're taking a pretty brave stance on this stuff, considering everything you've been through. You got a brass set of balls, my man.
Well, I appreciate it. And a lot of it comes from all that experience, though. Like, I've just seen this be so beneficial to so many people, and there's just this we've been inculcated with the wrong information, and people have this mental block to, I shouldn't use testosterone unless it's the absolute last resort. No, why? It's so beneficial. You're going to need it at some time anyway. Just get on testosterone.
When you start losing weight, your hormone levels will go down.
Somebody brought this up. I haven't heard about this. Somebody said, surprised you guys didn't talk about Dr. Trevor telling people the peptide mixes don't work because of pH. Like, look, I have not heard this. I don't know who Dr. Trevor is.
He's a disgraced.
Yeah, you do. Trevor Bachmeyer. We talked about him a couple weeks ago. He's the chiropractor who lost his medical license. Yeah.
Do not judge us by him, please.
Too late. Get him off the show.
Yeah.
Dr. Marv, we do not.
Good God. So, but I do know, I was talking with Travis Ortmeyer about it. He said some guy did a thing where he put, GHK to see how much it would degrade, because on paper in a vacuum, it's very reactive. And the guy said it only lost potency by like 1% like every day. Now I'm going from memory with a conversation when I was working the strongman games running on no sleep, but he and I both are like, that's way less. But yeah, don't follow that guy.
Janishik did some testing on peptide degradation and GH degradation. It was like pretty shocking, like how little, like they literally left GH sitting out in the sun.
Yeah.
And reconstituted, and it was like 80% even after 30 days.
Yeah.
It was something crazy like that. I was like, oh, okay.
Even
now the
tirzepatide and everything too, like the degradation is very little, even in the hot sun. It's like, it's crazy. Again, it's just this. We're just like, you're just hammered. This information is hammered into you that this stuff breaks down fast, and then when you're actually presented with the real data and the real facts,
it's fragile.
Cognitive dissonance doesn't let people get it out of their head either. Like they can't get that out of their head.
I just handle it with caution, just out of like I don't want to take any chances, but
But think about, like, if it was that fragile, the average diabetic, like their insulin would be ruined, right? Like people would be dying all the time because they're not going to take care. It's in their purse. It's getting jostled. It's in heat. Like if it really did that, like there would be issues. So it just, everybody just parrots stuff and nobody actually looks into it. And I was guilty of that with like seed oils real quickly. I've always parroted that they're terrible. And you look at human data, it's like there's no human data showing it actually increases inflammation.
Yeah.
It's all on paper in a vacuum, and then you just parrot it. And I was like, oh my God, I have to pull back. I've been spewing misinformation for 10 years like a dumbass because I didn't fully look into it myself.
But it's
great, Trevor, all along.
Yeah. Oh, no. But it's great that Dr. Marv, that you don't have that cognitive dissonance, because like when you present like a lot of people with facts, their brain just, no, I've been inculcated with this for 10 years. I can't, and then they'll just try to rationalize the old information because it's easier than just changing.
Well, if you follow an expert and they haven't changed their opinion on anything in 10 years, or they don't say, maybe it depends, we think, that is all flags. But then they're going to have a smaller social media following. Right. So,
Oh, we got a Dr. Marv question here if we want to grab that.
Perfect.
Sure. This one from Jorge. For Dr. Marv, tendinopathy and weakness of supraspinatus combined with tricep weakness. Any drills you suggest to speed up the healing?
All right. So tendons require load to heal. Muscles require rest to heal. So tendons, if it's a true tendinopathy, there is degeneration of the tendon. And what does the average person do? They go to their ortho, they get a cortisone shot, it feels better, and then they just do nothing. That will degenerate it further. So you need to load it. So isometrics are your friend. Supraspinatus in particular does the first 15 degrees of a lateral raise. So you could be doing isos there, just manually holding yourself. You're going to be holding it for at least 20, preferably 30 seconds, like 2 sets, 5, 6, 7, 8, 9, 10 times a day. You want to load that. The tricep weakness is probably just a defense mechanism, right? Our ancestors didn't have docs. So if the supraspinatus, if it's truly that, one way to test it is the orthopedic test is you're here, you're rotated in, yep, and then you're pushing down. If that's super painful up there, we know supraspinatus is involved. So yeah, doing your lateral raises, that'll be really important. The partial range of motion, make sure the rib cage is moving well. And then what typically happens is, like I said, ancestors didn't have docs, your brain's going to shut down force output to other muscles, and then everything's going to tighten up around the shoulder blade. So when people come in with that, I'm usually dry needling, if it's appropriate, levator scapula, trap. Rhomboids is big, but as I have said, everybody heard what happened to TJ Watt. Your person doing dry needling of a rhomboid, right, needs to be very skilled because needles and lungs don't mix, right? So if your person is not familiar with that, don't be doing it for a first time. And then I'll also needle, it sounds wild, but it's not as bad as you would think, subscap, teres, and lats. So you want to free up the shoulder blade, right? And then load that supra to get it moving a ton. And then in the meantime, you can train the opposite arm super heavy, especially triceps, because there's something called the crossover effect, which will maintain size and strength on the affected side until that defense mechanism goes down. And then other things, over-the-counter supplementation. Zinc is massive for tendons, and people miss that. But then you want your zinc to copper ratio. So education only, not direct medical advice. I'd have to say that. I apologize. I'm a big believer of GHKCU when coming back from a tendon issue. Vitamin C is dirt cheap way to increase collagen synthesis. And then obviously omega-3s, but something that I am a huge believer of that's not on a lot of people's radars is pro-resolving mediators. So anytime somebody has an acute injury, if you could start higher doses of pro-resolving mediators with fish oil, maybe some curcumin, and then vitamin C, that's pretty remarkable. So you're already going to get some of the pro-resolving mediators from fish oil, but it's been isolated. So inflammation can be restorative, reparative, or degradative, destructive. PRMs get you there, which is what you want. And it's not the same mechanism, but I almost kind of talk about it in office of like, it's almost like over-the-counter BPC in terms of how well it helps with healing, reducing inflammation. And so I like, if for myself personally, I always have a bottle of PRMs on hand and a bottle of BPC 157 on hand, because heaven forbid something happens, I could start it immediately. But that's stuff that people don't think about. I only learned about it when I did my functional nutrition like last year. And then it's pretty remarkable what that'll do. And then, yes, you could do other peptides, but load the supra and then train the opposite arm, and then just make sure everything's moving around the shoulder blade, and then get really good shoulder blade control. Why? Paul, can I pull up my screen on my anatomy app? Is that doable, or should I just keep talking? If it's too hard, I'll just keep talking. It's fine.
Yeah, just keep talking for now.
Okay, so on your shoulder blades, you have these hooks, right? And so if we don't have good shoulder blade control and pure internal rotation, right? So here's my shoulder, I'm doing well. If I go further, see how my shoulder kind of dips down, right? So, okay, so especially with a press, once you exceed pure internal rotation of the shoulder, you rotate forward. Then you're off your pec. It's putting strain on the bicep tendon and increasing strain on your rotator cuff. And you've got these hooks on the shoulder blade. Two things run below the hooks: your long head bicep tendon and your supraspinatus tendon. which is why the supraspinatus is the most commonly torn rotator cuff in who? Elderly females, because it's years and years of grinding and wearing under the hook with low blood supply. So you also want to get really good shoulder blade control. And step one would be starting on the rib cage, because most bodybuilders, because we're big and strong, are compressed. And then the rib cage doesn't move, your shoulder blade can't move, and then you're pinching stuff. And that was probably way too much info, but I get really excited talking about it. Does that kind of make sense, more or less?
Yeah.
It does.
And then hydrate really well, because tendons are 60% water. Nobody talks about that. And you're trying to flush out, because a truly degeneration of the tendon, side note, you're not broken, you're not fragile. That's my number one message, because people fearmonger, but there's water in the tendon, so the isometrics pump it out. And if you're not loading it and getting that resolved quickly enough, then you start to get nerve fibers in a tendon, which healthy tendons don't have nerve fibers, which is why once you have one tendon flare up, you typically have another one. Why? Because most people don't rehab it with loading it. But that's why once you had one tendinopathy issue, depending how long it's gone, some of the cells in the tendon can die off. Those are never coming back. So you got to load it as quickly as possible. If the pain is so bad you have to do a cortisone shot or prednisone, you get those so the pain goes down, so then you could rehab the hell out of it. Don't do, oh, I feel better and I'm not going to do anything. That'll degenerate it further. And then once you go back to your activity, it's like your threshold for pain goes way down, so it'll start flaring up, and then you have this chronic issue.
Wow.
My doctor told me when I tore my supraspinatus, he's like, I only see this in old women and bodybuilders.
Yep. Yep. Yeah, like majority, I think it's like, it's either 60% of 70-year-olds or 70% of 60-year-olds. It's that ratio have a tear and don't even know about it, right? So it's super common.
Can I build off that with something real quick? What's the frequency that you are looking for loading that tendon? Like what kind of, how many times a week?
So starting with isometrics, multiple times a day, 3 minimum, 5, 6, 7, 8, 9 is better. And then slowly building up, doing the range of motion you could tolerate, right? In the gym. And then, in terms of getting like shoulder blade control, when somebody comes in the office or I do a consult online, I go, look, all the shoulder blade rib cage stuff starting out at least twice a day, because making the change biomechanically is harder than maintaining. So start with twice a day. Once is pre-training or posing, then go to once a day and then once pre-activity. But if this flares up, you go back to your exercise Rolodex you've been given, and then you ramp it back up. So it's like an equalizer. But isometric, so tendons, typically you go isometric first, then eccentrics, right? Loaded, slow eccentrics. Now supraspinatus, not a huge range of motion. And then more explosive stuff. If for a lower body, for upper body, no, you just kind of go back to normal training.
Good.
Oh, and then one last thing. Sorry, I get too excited. Massage guns, vibration are awesome tool. So 10 to 20 seconds activates a muscle. So take it to the gym before your next work set on your dumbbell chest press. Run it on each pec for 10 to 20 seconds, put it down, do your work set. You'll feel a better mind and muscle connection. And then my strength athletes go, oh, I felt stronger. Then conversely, if this thing is barking, because tendons feel better when they warm up and then they suck when they cool down. So that's the problem of, oh, I feel great. So then you do what you know you're not supposed to do, and then you pay for it. So I've got 2 more bits of info, then I'll shut up. I apologize, because this is not a TED Talk. But 2 minutes of constant vibration. So find the tender point. Usually with supraspinatus, it's usually towards the outer third, not always, but usually. Find your tender point, set a timer for 2 minutes, because that's a long time. Gentle pressure, don't move it around. Hold it on that tender point. That vibration for 2 minutes, there's things in the muscle, it'll get it to relax a little bit. And then here's what's really cool. It interferes with pain signals. So pressure, vibration, and pain all enter the spinal cord in the same spot, and then they take different tracks up to the brain. Pressure, vibration travel faster than pain. So if you have that channel open enough, your brain starts paying attention to those signals, not pain. It's like you have a headache, smash your thumb with a hammer. It's just a much easier, nice way to do that. Then tendon issues. There is going to be discomfort while you rehab them. So you get to choose a line in the sand. Is it a 3 or a 4 out of 10? That is discomfort. Gen Pop usually says 3 out of 10. my bodybuilders, I'm like, you better be saying 4 out of 10 is discomfort. Otherwise you don't know how to train hard enough. And then that's your litmus test, right? So discomfort's the cost of doing business. If you wake up in pain, it means you did too much, typically the day before. And then tendon issues, this more applies to like tennis elbow, but we'll extrapolate to this. At first, pain will start to dimmer switch down, and then it'll be on off, meaning you'll be good all day. I remember the first time I had tennis elbow, I was good all day. I went to cut a steak, and it was like 7 out of 10 stabbing pain in my elbow. And I was like, what the hell? So when the pain is on and off, this is anecdote of my experience. That's good. We're moving in the right direction. So pain will dimmer switch, and then it'll be on and off. When it's on and off, don't get disheartened. That means we're almost done with that.
Wow.
Very interesting. That's great info. Thank you.
I'm just an educated meathead. I just nerd out all day. That's all I do. Yeah.
That's great.
It's a very thorough explanation.
Yeah. Sorry. That might have been too much, but
No.
Oh.
That's great.
All right, let's grab another bro question.
All right.
just a heads up, I got 10 minutes and I got another commitment. So if I sign off, that's why. So I really appreciate you having me on, Paul.
We're not on for not much longer anyway.
Okay. So we want a bro question, not a Dr. Marv question.
Do we want to get one more Dr. Marvin?
Yeah, one more round.
Since it's got to,
Okay.
since he's got to run.
This one kind of piggybacks off the last one because it's about tendon issues. This is from Larry. Don't know if it's my adductor magnus or my semitendinosus, but I have pain at the ischial tuberosity that prevents any hinging movement and makes pressing movement excessively painful. He said there was no acute injury. It's just something that started hurting years ago and has only gotten worse with time. Flossing seems to help, but only temporarily.
Everything comes in waves, and I've had 5 proximal hamstring tendon issues coming to my office last week. So apparently it's going around. So quick way to check is just, when you're lying face up, dig your foot into the heel. Does that cause your pain? And then if it doesn't, then just do resisted adduction, right? So like, what's the painful movement? A lot of times though, because those attach so closely, the issue starts with one, but they're attached so closely, it kind of goes into the other. So same thing. I started everybody with heel digs, which is sitting or lying face up. Just dig your heel into the ground, like push it down. You'll fire your hamstring. If it's an adductor, you do your isometrics, just resisted adduction. A lot of times this is training volume spike, right? We know if we spike your training volume by more than 15% from one week to the next, your injury rate goes up 7-fold. So tendons, if there's not an acute injury, there's usually just a training spike. Make sure you're hydrating. Same process starts over again. You temporarily get rid of hip hinging. I'm a big believer of blood flow restriction, right? For rehab and making your workouts harder. I showed working with a big bodybuilder, he had elbow pain. So until he was healing the tendon, he did BFR, banded press downs. Then he would do his upper body day and it takes away all the pain. So you could do BFR, like seated leg curls, right? Because doing that, start with a banded leg curl at home multiple times a day. And then the other things go through. I will say, you're most likely restricted in internal rotation. Yep. Okay. So then it's a hamstring. Education only, not directly diagnosing you. Sorry. I just got to do that. If it was me, I would say it's a hamstring. And then, so you're going to do the heel digs. Don't do any hip hinging. Start with banded leg curls. And then you're going to hold that contracted position for 3 to 5 seconds, right? You can do it lying face down, seated, whatever. I love BFR. So you could use knee wraps and then just wrap them. So yours already flossing. So Voodoo Floss is awesome. It should be every bodybuilder's gym bag, right? I have it in my backpack. I have it in each car. I've also had 9 surgeries beat to shit. So that's why I do what I do. But use the floss and put it on and wrap it around your leg. And then you could let it sit there 5 minutes on, 5 minutes off. That's cell swelling protocol from ACL reconstruction research, where they just do that and they heal 5 to 20% quicker. So that's awesome. So you could do that. You could also put it on and then ride an exercise bike. One study, when they're doing that, would just steady state cardio in 6 weeks. So this is important for bodybuilders. The diameter of their femoral artery increase. So it helps with blood pressure, vascularization, recovery. I have all my ultra endurance athletes do it, but I like it for bodybuilding too, because the blood pressure, increase in vascularization, it'll help it heal quicker. And then if you could find somebody, typically I start tendon issues with something called shockwave therapy, and then combining it with laser. And then I might have to finish it off with dry needling or newbie E-stim. But sitting on a lacrosse ball would be helpful. The vibration would be helpful. Keep flossing, it would be helpful. Sometimes there is a trigger point in the middle of the muscle belly, not just where it attaches. So you could kind of hunt around there. You could mimic grassed in with a spoon or a butter knife, right? So just put some lotion on the area. More bodybuilding gems. This is anecdote. It does seem, at least for me, when you're scraping them, if it sounds and feel gravelly, the fascia is super tight. And if I could get rid of that sound, my theory is if the fascia is so damn tight, it's going to be hard for the muscle to grow. Once I got my chest not to sound like that, my chest started growing. Same with my bicep. So if you're scraping, and hamstrings typically are that way. So you never scrape over a bruise though. So if you have an acute muscle strain, if you do grasping over a bruise, you could create cristium crystals in the muscle belly. That's all bad. And then you're not going to your bloody mess. But he could floss, lacrosse ball, do the heel digs, start doing banded leg curls, avoid hip hinging, blood flow restrictions, amazing. And then, yeah, for the super spadius guy, if somebody has shockwave therapy, I'm a huge believer in that. Dry needling could work to a lesser extent, but that's still a viable option, and more people have access to that.
Nice.
That's great.
And then he needs to work on his foot. So last thing, to release the entire line of fascia, this will help everybody. There's a guy smarter than me, which ain't hard to do, named Thomas Myers, creates lines of fascia in the body. The superficial back line goes from your forehead down the backside, all the bottom of your foot. So reach down, touch your toes, feel your hamstrings, see where your hands land. Roll out 1 foot only with a lacrosse ball or a baseball for 1 to 2 minutes. When you reach down again, that same side hand will hang lower and that hamstring will feel looser. So rolling out your foot will even help neck pain, it's annoying how well it works, because he most likely is restricted in internal rotation of the hip. And that's where hamstrings really need, because as you're flexing your hip from 60 to 100 degrees, you need internal rotation. That's a hip hinge. So most people with the hamstring issue, they can't internally rotate, which is stemming from the foot. So you rolling out your foot will release that fascia to help the hamstring, and then also start teaching your foot to start alternating between its two major shapes. So that'll help as well.
The Anatomy Trains book would be an excellent read for most people.
Anatomy Trains is a cure for insomnia. So I will warn people.
It is dry.
Yeah, so I actually, I cheated and I found DVDs in the Cairo School Library that had cadavers tracing the lines. So I eventually just did that. And then I have the posters in my office because visualization. But everybody start rolling out your foot before leg day, right? Especially if you're hinging. But that'll start, if you have super rigid feet, you can't get the arch to drop. When your arch drop, your whole leg rotates internally. So that's always step one for fixing a hip internal rotation issue, is start loosening up that plantar fascia so your arch could actually learn how to drop.
Is that also why your heels will come off the platform on?
Yeah, and then you've lost, your ankles are restricted because everything has to rotate, even your knees, even your ankles. So that'll also help release that superficial line, which will help the heel. But there's a lot more biomechanics. I'm trying not to go too far down a rabbit hole, but absolutely that will help a little bit as well.
Okay.
Wow.
And then whatever else I can do to help anybody, just let me know. My office is in Houston, Bay Area, but I do consults wherever. Sorry, shameless plug. But whatever I can do to help people, just let me know.
Great. Yeah, that's been great.
All right, bro question.
Okay, we got a lot of those. This
Time
one is a good one.
For the dumb questions.
Oh, we got Ryan on this really good one. For every other day injection, is it okay to alternate test E and test C, or is it better to run one fully before switching over?
Ryan.
Yeah, I don't. I mean, what it would come down to, if it made a difference, which for most people is just not going to make a difference. But it wouldn't hurt. For most people, it wouldn't hurt. Where it would come into an issue is just if your body, your esterases don't deal with the cypionate ester very well because it is kind of a complex ester. It's a pentyl group, and not everybody's esterase. Most people do; they deal with it just fine. But there's a small subset of the population that doesn't deal with that. That would be the only way it's a problem. Somebody asked a question about NPP versus DECA. They said is one more powerful or potent than the other, and this would be the reason. This is just my educated interpretation, but the nandrolone phenylpropionate ester is very complex, right? It's a hexyl group with oxygen, some oxygen in there. I have noticed, because just from a vast amount of just empirical data empirical and anecdotal data, that for many people, they don't, NPP is not as potent as DECA. The reason that makes the most sense is because of that, because everybody's esterases cannot take off that phenylpropionate ester because it's very complex, and your esterase may not be able to dock to the nandrolone to remove the esterase as well as easily as a straight chain carbon like decanate, right? The straight chain carbon's easy for your body to deal with. You do that with triglycerides all the time. So that would be the only reason. But for most people, it's not going to hurt to combine them, and you probably won't notice the difference.
I remember Kurt saying that there's studies showing that NPP doesn't peak as high as DECA does too. And he said the reason why people have less side effects on it is because it doesn't work as well.
It doesn't work as well. but if you think about it too, like they call it's fast acting, right? And a lot of people call it a short ester because it's fast acting. It's not short. It's actually a 9-carbon chain. It's just in a hexyl. It's in a hexyl group with some oxygens in there, and it's just very complex. So you got to think about it. The esterase would have to dock to the nandrolone and remove the whole ester at once, remove all 6 carbons, the whole chain at once, and that's why it's fast acting, right? Because you're moving everything at once. If you have like a decanate, which is a straight carbon chain, your body removes just 2 or 3 at a time, and you kind of have to go down the chain, and that's why its half-life is longer. But if if your esterases have a problem docking and removing that ester, then it's just it's not going to be potent.
All right.
Huh. Less sciencey answer to that testosterone question. I know whenever I switch between test E and test C, there's usually like I don't really have acne as a side effect, but I will get like some cystic acne if I switch esters like that.
That's interesting.
Yeah.
Mm-hmm.
Is it maybe different carrier oils from like SIP to nanthate or something?
That might be what it is. But,
Yeah.
I mean, it's something to consider if you're switching back and forth like that.
Yeah.
It's a good point, Mike, just about side effects in general. If you're switching back and forth, like to know which one is the cause.
Yeah.
Like
Very good.
you'd have to kind of narrow it down to just one and see if that was the offending substance.
Yeah. Either way, it sounds like either way the guy does it, switching back and forth or sticking to one is not going to make a big difference that I'm aware of either.
Yeah. For most people, like there are some people who can tell the difference between cypionate and enanthate. Most people can't, but some people can. So just figure out if one works better for you, and if not, then it doesn't really matter.
Sure.
Well, didn't Kurt's research show that enanthate holds a more stable serum level?
Yeah.
Yes.
Yeah. And again, what would make sense is because enanthate's a straight carbon chain. Your body deals with that easily, so you can utilize all of the enanthate. Whereas cypionate, if it doesn't dock to the ester and remove it efficiently, then you wouldn't be able to utilize all the testosterone. Right?
Yeah, makes sense.
But I'll ask you guys to see if you know anything about this too. Like another interesting thing is like if you go from either cypionate or enanthate to propionate, a lot of people notice with less water retention, and with propionate, less water retention to propionate. And if you think about it scientifically, it's like it's all testosterone, right? You're just breaking off those esters and utilizing the base molecule. So scientifically, it wouldn't even make sense that there'd be a difference. But unequivocally, there's just too much data, too much anecdotal data, and too much data in general to show that people actually do. Not everybody, a large enough subset of the population has less water retention than propionate that it's a thing. I don't really have an answer as to exactly why. The only thing I could think of is that exactly what we're talking about. If you have like testosterone cypionate that can't be de-estered floating around, maybe there's some water retentive effect from that. But propionate, you're using it very quickly, right? It's just a straight 3-carbon chain. You're removing it right away and using it. That's why it's got a short half-life, and so there wouldn't be a lot of esterified testosterone just floating around your blood. I don't know. That's just a guess. I don't know. It's interesting.
Well, couldn't you have like a inflammatory response for taking longer to break down a difficult pain, like you're saying?
Right. Yeah. If you have just esterified testosterone, there could be some inflammatory response from that. Yeah. I don't know exactly, but it's interesting. It's very interesting. I mean, do you guys notice that? Hey, see you, Dr. Mark.
See you guys.
Thank you.
Have a great day.
Do you guys notice people having less water retention from propionate?
I do. Yeah, I have a lot of guys
Yeah.
that are fans of switching to short esters on shows, and it's kind of noticeable. Yeah.
Yeah, it's really interesting. I mean, we don't know exactly why, and scientifically it doesn't even make sense, but it's
I didn't look much into it other than what I said. I just figured the body had an easier time absorbing propionate, and it just led to less inflammatory response of breaking that down in the oil depot itself too, you know. But that's just my guess.
Yeah.
Sounds logical.
Yeah, I like it. Have any of you ever used any test-no ester, and if so, in what context?
Yeah, I mean, I have pre-workout a few times, test-based, no ester. Yeah, and just to experiment with it. I didn't really notice much of anything other than a little extra aggression in the gym, but no strength difference. I actually seemed to feel a little off from getting those spikes over like a week and a half of doing that, because it's very immediate and very quickly clears. Like you have to almost do a pre-workout, like immediately pre-workout to a point.
I used to use the suspension, the water-based suspension. Remember that? Oh my God, it was so painful. Oh, do you guys ever
chalk
use
it up to being useless now? I mean, I don't really see the use of it, to be honest.
Yeah.
Anadrol exists for a reason.
Yeah.
That's what I was just going to say about the test-no ester, is that halotestin has a very similar effect to just being a fast testosterone reaction that will add to a lift, or I know MMA fighters use the test-no ester on fight days.
They're getting that high androgen response that gives the
and you can't test for it.
I was just going to say, it's good for testing because it's in and out of your system so fast. Like,
Well, tretinoin ester exists.
Yeah, and that shit burns like a mother. I'll tell you that.
Well, and trinacetate is just 1 carbon too, right? So it's like trinacetate is very fast acting. Or I you know what's funny is like nobody uses test acetate, and I used to add it to our Sustanon. I would add test acetate, so it could be Sustanon with Sustanon 300 with test acetate added. And sometimes I would make myself some vials of just test acetate, and it was like propionate or even kind of like no ester, but it was painless. That's what I loved about it. Like I didn't have any pain from test acetate, and it acted like prop or no ester. It was really neat. I don't know why it's not popular.
I'd imagine you felt good pretty quickly.
Yeah, you felt good. I just couldn't believe there's no pain from it. Like, so it's like all that pain from test propionate or test no ester, and you can just avoid that by using test acetate. It should be more popular.
Somebody gave me a long time ago, gave me some methyltren one time. That was some wild ass shit.
I feel like that's how you test to see if kidneys are going to die.
I took it one time and I was like, I was so aggressive.
Injectable or oral?
Oral.
Yeah.
Oh my gosh.
Yeah.
I got a few bottles of oil-based I'll probably never use again. But that stuff is strong, that's for sure.
All right, want to get one more in?
We've got 2 that are really quick ones. So let's we've got this really quick one from Benny. Good source to learn posing. Any books to teach it properly?
No books. I Kenny Wallach has some decent videos up on YouTube. There's this one seminar he did like a fucking decade ago. I still point people to all the time.
Terrence Rupkin makes some pretty good content around posing too. If you search some of his stuff
Does he?
on YouTube,
Yeah.
he does. Yeah.
Chris Tuttle has a fantastic book on posing that he
Does
put
he?
together years ago, and he's been kind of editing over the time as as posing's kind of evolved. He kind of
Didn't know
recognized
that.
Yeah, I think you can go right to his IG and get it through his LinkedIn or something like that.
I need to get Chris on sometime and talk to him. He's one of the guys I think that seems to be consistently getting results from people.
Well,
Yeah.
Tanya said that Daniel Coffeen is great and has a school group.
Yeah, it seems
Yeah,
like
Daniel has some stuff. Daniel's helped me in the past.
Yeah, I've worked with Daniel too, a little bit. He's really good if you just want to learn some fundamentals. He's really good at teaching the fundamentals like foot placement and things like that.
Apparently also someone named Grassfed. I don't know his real name, but he has posing classes. Are these on YouTube or
I think
not
that's
sure where to find
IG.
those, but yeah. Instagram, maybe. Yeah.
Yeah, I believe that's a good IG guy's name that does posing.
Okay. Grassfed on Instagram. All right. One other quick one we got from Bruno. What do you guys think of popcorn as contest dieting, high fiber loading? I mean, I love popcorn for volume. The only thing I'd say you have to be careful with if you're eating a lot of popcorn is that the hulls can become problematic for digestion because they don't really break down a lot and they can be really sharp on the edges. So if you eat a ton of popcorn, passing it might be uncomfortable if you're not breaking down all those hulls efficiently.
I had a guy one time, this is an odd one, that was eating a bunch of popcorn and nuts and ended up all collecting in a diverticuli and ruptured.
Yeah.
Yeah.
I've had, some people have had like a little bit of like rectal bleeding because of, again, the holes being problematic on passing, or intestinal pain from the permeability of the holes. They're sharp. Other than that, though, I love popcorn. Sweet, savory, it's tasty.
Well, you just convinced
Like
me not
broken
to
up rice
do
cakes.
popcorn because I got diverticulitis and I'm not going to.
Oh yeah, I would avoid it if you have diverticulitis.
I just think it's gross.
Yeah, that's always nuts. I think they tell you if you have diverticuli that you shouldn't eat nuts,
Or
if I
broccoli.
recall correct. Yeah, it's like there's a lot of things that have husk and stuff in it that you're not supposed to eat when you have diverticuli because they can collect in it and rupture it.
It's like my
Yeah.
favorite go-to added
Popcorn
fat
being one of them.
almonds right now. Oh boy.
Yeah, you might want to look up. It might be specific nuts. I don't remember off the top of my head. I'll have to look.
I think a lot of it comes down to how well you emulsify them, because if you're kind of just chewing them and keeping them solid, you're not going to break down the nuts very easily anyhow. That's what, so I could imagine that's part of it, how well you actually chew up your food and emulsify it before you eat it.
Oh, that's
Yeah.
so true, Dave. Especially with almonds, there's actually studies, the thermogenic studies where they look at how many of the calories from a food you actually absorb. Almonds are actually pretty low on the list because people don't masticate them well enough. Like they don't chew them up enough so that a lot of it does then pass through undigested. That's
Yeah,
so
it
true,
says-
especially with
It
almonds.
says nuts, seeds, popcorn, beans, lentils, peas, brown rice, bran, and whole wheat bread should all be avoided if you have diverticulitis.
Yeah, I think you only absorb like 60% of the most nuts that you eat, I believe.
Yeah.
There's a number for it that I've seen. I think it
Tanya
was
says
60 or something.
almonds are fine. Yeah, I thought almonds were okay. For whatever reason, I specifically remember pistachios are a bad one.
Yeah.
Well, things with skins, skins or seeds that can kind of get trapped in the little, microvilla, like those little folds. Like that's why peas and beans are on that list, because again, you're not breaking them down. So like you would chew up the soft part of the bean, but then a lot of times the full like skin of the bean goes through completely through digestion. So they can get trapped. And I guess if you were eating almonds that had like those really thick skinned almonds, that could then become a problem. Like anything that has that fibery shell, like a bean or a pea that doesn't get fully broken down through mastication.
Yeah, like brown rice as well.
Yep.
Like you
Same
mentioned.
thing.
I've
Amy,
seen
would
a
you
lot
say
of guys
that,
fuck themselves up with brown rice.
Yeah. I was going to ask you, Amy, do you think it plays a difference on like where you are in prep? I mean, because your colon and your GI get so kind of dehydrated towards the end, where even
Oh,
you know,
yeah.
a diet that you should be able to digest quite well becomes difficult to pass. I mean, it happens for everyone.
Oh,
You think
100%.
that-
And just food volume too, so not having as much to push through, can slow things down. You may not be getting those signals from the migrating motor complex as efficiently. So like everything can just kind of start to slow. So then even a small amount of food that you may have been fine with before may sit in your digestive system a little bit longer, cause some gas and bloating. Like also systemic stress, is going to be a big factor in that as well. And hydration.
Yeah. And what kind of inflammation you have in your GI tract at the time while you're eating this too. Yeah.
Yeah. Yeah. And that goes back to the stress component of it too. I think we all don't really realize how stressful prep is on our body. Like we're asking it to do something so extreme. And I think especially now that people are getting through preps, quote unquote, easier by using GLPs, just because you aren't experiencing the brain signal of hunger and of, the starvation being a pretty strong word, it doesn't mean that your body's still not experiencing those same symptoms when you are pushing it to that extreme level. Like, I don't care if you get to 5% body fat starving or not starving because you were on a GLP mentally, your body it still is getting there. Like it's still having that same stress on your body. So I almost feel like people might ignore other symptoms of being in the depths of prep that they may not see as much just because they're mentally not hungry. So they might brush some of it off a little bit more, but it's still there. That stress is still there.
Yeah.
Interesting. Yeah, that makes sense.
Tanya, who's eating brown rice, it's 2013. Oh, I remember back in the day, everybody was doing brown. Oh, God,
yeah.
How do you do that stuff? It's
Love
terrible.
Why would anybody
it's
want to
like-
slow down the digestion speed of a perfectly timed carbohydrate?
No, it's the chewiness. It has that that amazing mouthfeel. Like, yeah, I love brown rice, but I don't eat it. I eat white rice.
In our household, it's so weird. Jackie only does basmati rice. So she'll fill up the whole rice cooker with basmati. And then I do like 80% jasmine, 20% sushi. So it's like the total opposite. So we can never share rice anymore. Kind of annoying.
That's maybe a good thing though, because then no one is eating somebody else's rice.
Yeah. I do the cooking, so I guess I got to do it twice.
How many rice cookers do you guys own?
We just used one, and it's this monstrous one. I can do I think 12 cups of dry rice fills up the whole
Oh
thing.
my gosh.
It's a good amount. Yeah. But we got our slow cooker that has a button for that as well for rice. Yeah.
Yeah, for a while there, it was one of those things I was buying every time I got off an airplane. I've left so many rice cookers at Airbnbs. It's not even funny. That kills.
You can tell in my house who's on prep. Just go to the rice cooker and see what kind of rice is in there, and whoever's on prep gets the fresh rice privileges.
See, that's another thing with digestion, Dave. When you're on prep, like eating old food will definitely start to mess with your digestion more than it does when you're not on prep, most likely. Yeah. You're just so much more sensitive eating that old rice. Yeah. Yep.
All right. I think we're going to wrap this one up, right?
Right.
Thanks, everyone.
We did not get to your question. Ask it next week because we did have some other good ones, but
It's a busy live. Everybody snowed in today here on the East Coast. So
oh my gosh, that's true. That's why.
The chat was lit up. That was good.
everybody's at home. They can't go to the gym because we shut down in the South when snow hits us.
I love how you
We're
call
not used to
yourself
this
the South.
I mean, technically, I'm below the Mason-Dixon line. So
I mean, you were a slave state, but I mean, I'm in the South and it's 30. This is awful.
Well, it's a whole 24 degrees here on the West Coast, so I'm heading to the gym.
I think we are colder here right now. Let me tell you what. Let's see. It's 24. 24 and sleeting.
We made it to 20. This is exciting. Double digits.
It was 1 degree this morning, and we're right now 4 degrees.
Do not
Oh,
know.
gosh.
Yeah.
Oh, no, thank you.
Fuck, man.
I'll take my 20.
Yeah, I looked at
I'll-
Arctic clothes just because of how cold I think Columbus is going to be compared to what I'm used to. I've got merino wool coming and stuff.
I brought all my thickest sweatsuits to Ohio last year.
Good. You're gonna
And
need
just don't walk.
was
Just
cool.
don't let Amy tell you anything's a short walk. Oh, it's a short walk.
It was a short walk.
By your definition.
Amy and I already decided we're doing scooters with training wheels on them.
Amy's definition of a short walk is very different than mine.
I got a ghetto blaster I can bring. We can listen to some loud music while we ride.
Yeah, be the scooter gang.
Hell yeah.
All right, folks. We'll see you next week. Appreciate you.